Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you today?
Doing just well. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers all of your COVID, infectious disease, and public health questions each week. And today, Dr. Murphy will be addressing the latest headlines and the non-US COVID statistics through today. Happy Halloween, October 31st. We invite you to submit any questions or comments down below at any of our social media or the comments. So, no updates on COVID through the government shutdown. We'll make more updates when they come, but for now, we're going to get straight into those headlines. Starting with new COVID guidelines for those that are immunocompromised. Could you tell us about them, Dr. Murphy?
Yeah, well, the CDC and the FDA had been really making all the guidelines for the United States for many, many years, and they were highly respected. But this has gone to the wayside as a bunch of basically fringe people, I won't even call them experts, have taken over that. And they've changed things, and it's not been an improvement at all. It's been a detriment. So the professional societies, and these are highly respected, true experts, the Infectious Disease Society of America, the American College of Physicians, there are many others, and many states have very good health departments that have taken over the guidance, directing the guidance for their populations. So the Infectious Disease Society this week, which I'm a member, recommended that all adults and children who have a weakened immune system, in other words, you have some underlying disease, you're older or way young or whatever, receive age-appropriate vaccine doses as soon as possible for the upcoming respiratory season, which is starting now. So the respiratory illnesses that can cause a lot of problems are COVID, flu, and RSV for respiratory syncytial virus. So that's just starting now. It'll take off more in December, and in January, it'll go crazy, January and February. And so they're recommending if you've got any medical problem that get vaccinated now so that you're protected when the season really hits. Now, they are not going to make recommendations for people who are otherwise healthy. They're leaving that up to the American College of Physicians. I had hoped they would just say, we're going to follow the same guidelines and come up with the same thing. But they're going to leave the sort of the healthy population guideline to them, and they're going to just focus on people with underlying diseases.
Yeah, and speaking about that quality of decision making that you mentioned earlier, there was a very clear and standardized report done of the current policy maturity of decision making. If you could explain that, of the current ACIP from the CDC. Can you remind us who they are and what this report found?
Yeah, so the ACIP, which is the committee that advises on immunization practices, the 17 members were of experts that have been on there for many years. Some of them has been dismantled completely. They were fired, basically. And they were replaced by really a whole lot of vaccine skeptics, people that have publicly stated in the past that they don't think you need vaccines or that the vaccines are incredibly dangerous or whatever. That's what happened. So some of these older members, they're very smart people, and they investigated and scientifically critiqued all the decisions that have been made by this new group. And they came to the conclusion that the immunization practices things are scored by how effective they are, dropped from 100% to 58% between April and September of 2025. They were particularly concerned with the changes that have been made, the number of people that are not going to be told to get vaccinated or advised to be vaccinated. And they identified significant criticisms of the current ACIP committee, the new one, by removal of choice for previously recommended vaccines, limiting opportunities to improve health, focus on theoretical vaccine harms using very low quality data, loss of vaccine science and clinical expertise, they were all let go, and less transparency and independence, which they've been whining about for a long time, but they themselves don't follow that practice. So they're basically saying, the quality coming out at the federal level has fallen dramatically. And what they're saying here, they're not saying it in print, but what you take from this is what we just spoke about. Go to the professional societies, go to your state society. If you're in a state with a good health department, not all health departments, state health departments are great. We're fortunate. Illinois is great. Illinois and Chicago have very good, excellent health departments. New York, California, Oregon, Washington, and some of those states have actually um, banded together and set up their own networks to make recommendations. So we've got to, unfortunately, the CDC is no longer considered an expert in the area.
Very unfortunate, but very fortunate that we do have these various societies and local governments that are sticking up for the scientific evidence here.
Yes, with true experts who are trained in the field, have dedicated their life and service to protecting the public health.
Mhm. And some of those experts just released some, or published, I should say, some new data regarding the spread of COVID linked to air travel during the pandemic. Can you tell us about the finding?
Yeah, well, this is actually a group from Hong Kong. And it's published in the Journal of Infectious Diseases, which is a very reputable journal. And they analyzed flu and COVID data from 73 countries from January 2019 to July 2024. And so what they found was really quite fascinating in that it's flight volumes, how crowded is the airplane and how long you're in that airplane and where that airplane is going. So long haul flights from Asia to elsewhere were the ones that had the highest risk a person could be spreading either the COVID or even the flu. So they also found that shorter domestic flights were not associated with that. So it makes a lot of sense. If you're in a confined space for that long a period of time with the air recirculating, that you would be more at risk. And so the take-home point is during high periods of infection, like this coming January, December to March, maybe some restrictions or some recommendations should be put in place, especially on these long haul flights. That's up to the individual airline and country running the airline or where they're landing or whatever. But I mean, if you want to cut the risk, that's the high risk place.
Mhm. And some great reasoning as to why you would want to do that. There was some very, very stark evidence just found about the rate or the possibility of heart attack and stroke after both flu or COVID infection. Can you tell us those numbers?
Yeah, so this is a study published very recently in the Journal of the American Heart Association, highly respected journal. The team that put this together was from UCLA, the University of Cape Town in South Africa, and the University of Texas in Houston. And they found that flu and COVID led to a higher risk of heart attack and stroke in the months following the infection. And it was dramatic. They looked through 155 different studies And they found that individuals were 4 times more likely to have a heart attack and 5 times more likely to have a stroke within a month of an influenza infection, and 3 times more likely to have a heart attack or stroke in the first 14 weeks after having a COVID infection. I mean, this is dramatic. Now, we knew that COVID in particular was associated with cardiac problems, but this is very dramatic data. I mean, it's just everyone thinks, oh, I have a little cold, I have COVID, it's minor. This is not these are not minor diseases. They have short-term and long-term effects, and not only long COVID, but they've got increase your risk for heart attack and stroke dramatically. So it's just more data that's piling up, and more reasons why you should do anything to not get those infections if at all possible.
Absolutely. And on that note of long COVID, there was new data also posted about long COVID in youths and adolescents. Can you share that data with us?
Yeah, the whole long COVID story, it's confusing because there's no real definition. And, is it how long is long COVID? Is it 1 month, 3 months, 6 months, 1 year, whatever? But people know bad things happen to a relatively small number of people. But anyhow, we always say, well, kids get COVID and, so what? It's like they just get over it. But kids can get long COVID. And they found in these studies are rather large, 465,000 children and adolescents with documented COVID infection between January 2022 and October 2023. They found that in the kids that had a COVID infection a second time, so they got reinfected after the first time, had twice the risk of having long COVID compared to the first time. So, however you define it, it's twice as bad the second time you get COVID if you're a kid. So that's a lot of kids getting sick and getting these long course of infections and other problems.
It is unfortunate, and it would not be a 2025 installment of the Ask Dr. Murphy series if we were not talking about the measles. Can you bring us the the latest on this measles outbreak?
Well, it's not going away, and it probably is very unlikely to go away. And the United States and Canada, by the way, are probably going to be taken off the measles free zone list of countries because we're having so many cases and it's not slowing down. And it's likely to continue because our vaccine uptake rate is not going up, it's actually going down. So these outbreaks are just going to continue, and we're just going to be a country with lots of measles outbreaks. So why is that important? Well, measles is highly, highly contagious. It's one of the most, if not the most contagious infection that's known to man. And people get hospitalized. Approximately 12 to 15%, and people can die. There's been 3 deaths in the United States, 2 in children, 1 in adult, all unvaccinated. And there's even been studies done looking at the actual cost of a measles case, because it includes the hospitalization if it's a severe hospitalization, ICU, and if the person dies, loss of wages, all that stuff. And it's about $44,000 per case. So this is not a small amount of money when you're now talking in the thousands of patients. So, we still have, in the United States, it's 1,648 cases. Canada's even higher, but it's having a health impact and an economic impact as well. Totally preventable disease.
Totally preventable, absolutely. And our last story for today is checking back in on those Clade 1 Mpox cases that popped up in California. And now I understand there's been similar cases over in Europe.
Yeah, so there's two like strains of Mpox. So there's the Clade 1b, which is the one from East Africa, and that's been associated with mortality rates up to 10%. And then there's the Clade 2. Those are the ones mostly in Western Europe and North America. So they found in Los Angeles recently, and we discussed this in the last couple of weeks, there was actually 3 cases in the Los Angeles area, cases that were unrelated to each other, that were this Clade 1, the more difficult one. All 3 of them required hospitalization. So these are sick people. And if you look at the whole Mpox problem, in 2022, when that outbreak happened, it caused 32,000 cases. This is in the United States, 58 deaths, and there was a lot of people that were sick. And there's a vaccine for this to prevent it. And in Europe and in the US, they're recommending that people get this vaccine if you're at high risk. So high risk is people that are around people with Mpox because it's spread in a contact fashion. In Africa, it's usually in clusters of people. In the United States, it's mostly transmitted from men who have sex with other men. And so if you're in a high risk group, you should take the vaccine. They're giving the vaccines in Africa now, and we have them here, but it kind of died out as the cases went down. But now the cases haven't gone away, and now that Clade 1 is here. So that's something we need to be concerned of, and the vaccine is highly effective.
Absolutely. And we will keep an eye on that as much as we can. There are some reported difficulties in tracking smaller diseases with funding cuts and the like, but we will keep as up to date as we can on that. But on that note, I would like to thank you, Dr. Murphy, for your time and your expertise breaking down all the data for us today.
Well, thank you, Katie.
And thank you all for joining us for this week's episode of Ask Dr. Murphy. Happy Halloween. We hope to see you back next week. And of course, if you have any questions or comments, please leave them down below. Have a nice weekend.